Let's continue our subject on interviewing emotions and mental state. Mood swings are often seen when there is liver qi stagnation. There is no stability to the emotions because the liver is not ensuring that the qi is flowing smoothly. Heat in the liver will manifest with irritability, and the person can have a tendency to be temperamental and have a quick temper or be impatient. They will have a quick temper because anger is the emotion that resonates with the liver. Severe stagnations of liver qi can lead to a depressive condition. This is because liver qi stagnation can prevent the movement of the hun. This will result in a person having difficulty seeing a future ahead of them. They cannot conceive of a future or a situation that is better than the emotional pain that they are feeling at the moment. When there is liver qi stagnation, you can sometimes sense that there are pent up emotions when the client describes their life. Phlegm can also lead to depression. Here, the shen becomes blocked and smothered. The person will have difficulty connecting to other people. The person can also seem torpid and difficult to engage. Heart chi stagnation and blood stagnation can also result in a person's shen having difficulty emanating outwards and connecting to other people. At the same time, the stagnation of chi in the heart can manifest with a lack of joy. Heart stagnation conditions can also lead to depression or depressive conditions. When the heart is harmonious, it manifests joy. If there is heart chi stagnation, there will be a lack of joy and the person will be gloomy and sad. Conversely, if the client says that they have lack of joy or love in their childhood and in adult life, this can lead to heart chi deficiency. The lung is affected by grief and melancholy. This can also be an aspect of a depressive condition. The person may mention a specific event that their condition can relate to, but it can also be something that is very far back in the past. Grief and loss do not, of course, have to manifest as depression. If a client talks of grief or loss, it may be something that has affected their lung qi. The metal phase gives us the ability to experience, but also let go of grief and loss so that we can move on. If the metal phase is not in balance, its chi will not flow and the person will have difficulty letting go of grief. I usually ask patients whether they are good at saying no and setting boundaries. Liver deficiency conditions and liver chi stagnations can manifest to some extent in a person having difficulty saying no and setting boundaries. Conversely, by not being able to set boundaries, they will often develop a stagnation of liver qi. Mental restlessness and its extreme form, mania, is a sign of heat agitating the shen. So the person has difficulty concentrating and being tranquil. Anxiety can be related to certain situations or objects. It may also be undefined. Anxiety will weaken kidney and heart chi, but in itself, it's often a manifestation of heart and kidney imbalances. The memory depends on Jing, Shen, blood, Qi, and Yi. A poor memory can therefore be a reflection of imbalances in the kidneys, heart, and or spleen. Usually, it will be a deficiency condition, but phlegm and blood stagnation can also block the Shen and thereby the memory. Shock can also dissipate the Shen and lead to amnesia. Difficulty concentrating is seen when the heart and the brain are undernourished, blocked, or agitated. This means that the heart chi deficiency, heart blood deficiency, and kidney jing deficiency can manifest in poor concentration. The person will often feel empty headed and a bit dazed. Heat in the body will always ascend due to its yang nature. Heat will agitate Shen, causing the person to have difficulty concentrating due to the mental restlessness and many thoughts filling the head. Spleen Qi deficiency can also cause a person to have difficulty concentrating because the weakening of their Yi will result in them having difficulty focusing their thoughts. Dampness and phlegm can also mean that there's difficulty concentrating because the person feels that their brain is wrapped in cotton wool. The blockage resulting from phlegm dampness means that information and impressions have difficulty penetrating into the heart. If I suspect that a client has phlegm dampness, I ask them if they have a foggy or blurred sensation in the head, as if there's a blanket smothering their mind, or the sensation of being locked in a bell jar. This is the sensation most of us recognize from when we have had a heavy cold or have been hung over. So here we see the mental emotion signs. If a person has depression, it may be liver qi stagnation, heart imbalances, or phlegm. If the observation is speculation, he's worrying, thinking in circles, then it may be a spleen qi deficiency and dampness. If there's anxiety in the person, it may be a heart and kidney imbalance. If the person has wrath or anger, quick tempered and impatient, it may be heat in the liver. If they have difficulty saying no and setting boundaries, then this is a liver stagnation or liver deficiency pattern and liver qi stagnation. If there is mental restlessness, then it may be due to heat. If the person has mood swings, it will be liver qi stagnation. If the person has poor memory, then there is heart blood deficiency, kidney jing deficiency, spleen qi deficiency, or phlegm dampness. If the person has difficulty concentrating, then this would mean heart blood deficiency, kidney jing deficiency, phlegm dampness, spleen qi deficiency could be heart fire, phlegm fire, heat. If the person has a foggy and slurred sensation in the head, then this would mean phlegm dampness. Thank you for your attention.